What is depression? Depression is a low stat state in which life seems dark and its challenges overwhelming. There are several symptoms of depression: emotional, motivational, behavioral, cognitive, and physical. The picture of depression may vary from person to person. Some people that have depression may have symptoms that are less severe. Some may manage to function, though their depression robs them of effectiveness and pleasure. Like I stated above, some may have symptoms other than sadness. How does persistent depressive disorder fit into unipolar depression? This is a chronic disorder that has repeated major depressive episodes, a pattern called persistent depressive disorder with major depressive episode. Others have less severe and less disabling symptoms, a pattern technically called persistent depressive disorder with dystemic syndrome. An individual with these symptoms must display major or mild depression for at least 2 years. During these 2 years, they must also not be absent for more than 2 months at a time. The history of persistent depressive disorder. The term dysthymia was first coined in 1844. However, the actual diagnosis of persistent depressive disorder is more recent. It was first published in the DSM-3 in 1980. Its diagnosis happened consecutively with the removal of several other previous diagnoses. Persistent depressive disorder was originally called dysthymia or low-grade depression. The depressive disorders such as major depressive disorder were thought to be all-inclusive. Along with this, the modern description of dysthymia was made by Kalbum. Kalbum distinguished dysthymia from the fluctuating mood of cyclothymic. Although there has been an ongoing battle to separate low-grade depressive disorder and an apparent abnormal personality trait, the DSM-2 defined chronic depression as a personality trait rather than a disorder. Now, according to the DSM-5, you can now be diagnosed without the progression of the illness within a span of 2 years. Despite the progress made with the inclusion of the depressive disorder to the DSM, the validity of the illness continues to be questioned. The symptoms of persistent depressive disorder. According to the DSM-5, symptoms of persistent depressive disorder include a depressed mood that occurs for most of the day, more days than not, for at least 2 years. 1 year in children and adolescents. During this time of depression, at least 2 of the following must be present: appetite change, sleep change, low energy, low self-esteem, difficulty concentrating, and feelings of hopelessness. Prevalence rates of persistent depressive disorder. The prevalence rates show that 1.5% of the U.S. population age 18 and older in a given year are diagnosed with dysthymia. This is approximately 3.3 million adults, and only 61.7% of them with MDD are receiving treatment. On average, the age of onset for U.S. adults is 31. There's also a higher rate of dysthymia in women than in men. According to the academic article, there is a difference in the estimates of depression for a person that has a history of hypertension or asthma. The connection to a physical or biological illness increases a person's susceptibility to mental illness, such as persistent depressive disorder. One student found that those diagnosed with dysthymia also have a 54.8% chance of being diagnosed with MDD, major depressive disorder, and those that are diagnosed with MDD are found to have a 44.2% chance of being diagnosed with dysthymia. There are several approaches to treatment for persistent depressive disorder. One of these is cognitive behavioral therapy. This focuses on eradicating automatic, irrational thoughts. It also focuses on changing maladaptive coping behaviors that are responsible for the depressive symptoms and mood. The interventions that are taken within this treatment are founded on different techniques that help patients with self-monitoring, setting goals, identifying and changing distorted cognitions, increasing their social problem-solving skills, and engaging in more relaxing and impulse control techniques.